Hi, welcome back to the Wyoming Vein Specialist and Casper Medical Imaging YouTube channel. I'm Dr. Charles Balkley and thanks for tuning in. So last time we were talking about compression therapy and what it's like after you've had your treatment. We fielded a number of questions about what type of activities one would either want to partake in or would be able to tolerate after they've had a treatment. And I think that this is very important, especially for the young active culture that are marathon runners, bikers, hikers, climbers, people who are very active. This tends to be a little bit of a knot in their hair because they do have to wear those compression hoses for 2 weeks following, and we really require that their activity is mild at best. And why is that? When you have treated a length of vein and created an inflammatory response around that vein, your body's intention is to allow that inflammation to heal the vein shut. If you're constantly moving that vein back and forth by doing different types of activities, you may prevent that vein from healing adequately. So gauging mild or moderate activity such that you're not creating enough pressure in your abdomen or pelvis by bearing down, lifting heavy things, or trying to force blood back down into the venous system so that that vein can heal shut is usually the typical course of therapy. How long do we ask patients to refrain from heavy exercise such as weightlifting, running, rowing, biking, hiking, or any sort like that? 2 weeks, just the duration of having the compression hose on. Now, for the vast majority of Americans, this tends not to be a problem. However, the opposite is also true. You can't go home, lay down, put your feet up on the edge of the couch, and think that your vein is going to heal well. You need to remove the inflammatory mediators from the lower extremity, and so we ask patients walk at least 3 times a day for at least 15 minutes per time. We don't want you to break a sweat. We don't want you to get that arterial pump that you may feel if you go on a run. The idea is just to remove any of the inflammatory mediators through the normal veno-lymphatic channels that are helped out by using the muscle pump mechanism of the calf and the thigh. So 2 weeks, mild, maybe moderate activity, not breaking too much of a sweat, not creating too much intra-abdominal or intrapelvic pressure, but at least walking 3 times a day, 15 minutes per time, so that we can actually help actively assist those veins to heal. Thanks for tuning in, and remember, we'll walk with you until your legs are healthy again.